The V's, or the injections or the shots, you can call them, are not approved by the FDA. And I'm going to show you the proof. And you can show this to all your friends and families who are saying, yes, it's approved. Yes, it's approved. No, it's not approved by the FDA. Now, this is a really quick search that you can do. Let me take you there. Anyone can do this. All I did, I'm going to share my screen, was put in Pfizer Biotech emergency use authorization, letter of authorization. Okay, and then you'll take you right to the FDA and it'll bring you to this 9-page document. And we're going to go to the start of it. So send them to this. This is going to prove to them that is not approved by the FDA. Again, it's not approved. It's authorized for emergency use authorization, which is completely different. In order for a drug to be approved through the FDA, it goes through the proper approval process. But they do emergency use authorization to skip over that process in order to get the drugs out quicker when they think that the risk outweigh the benefits. Now, do the risk outweigh the benefits? With a 99.91% survival rate, and with this being an investigational drug on an entire population that has never been done before, well, you need to critically think and you need to do your own research, review all of these things and think for yourselves. Now, me as a nurse, I've been a nurse going 25 years. I can kind of read between the lines, so it might be a little bit easier for me, but this is why I'm putting this information out so you can educate yourself and make proper decisions. All right, so let's bring this up so everybody can see it. So they had to renew this emergency use authorization because they changed a couple things, and I need to go back and figure out what they changed. I'm just doing this, honestly, by the seat of my pants here, whipping this up really quick because this is just so important. Everybody is saying that it's approved by the FDA. Nope, it's not. All right, so on February 4th, they declared a public emergency. And we won't go into that. So on December 11th, right here, the FDA issued an emergency use authorization for this injection, for the prevention for 16 years of older. And they changed it. They changed it. They removed a reference to the number of doses per vial, which I haven't looked that up yet, but I'm going to be doing that today. Okay, so they reissued to change it for a couple of things. But I am just doing this video so I can show you that it's not FDA approved. So that is the purpose of this video. So let's go through this really quick. All right, so where is it? So just let's go over this. It's to prevent the COVID, which it actually hasn't been proven to do yet. It contains a modified, which is modified means synthetic. So if you don't want to put GMO food into your body, why would you want to put a synthetic modified something injected into your body, which is way worse than ingesting, completely different, okay? It metabolizes differently and it gets excreted differently. So when you eat something, it goes through the digestion process, but when you inject something, it actually ends up through your whole body and it has a completely different way of releasing these toxins. Now, here it is. It is an investigational vaccine not listed for any indication. It says it right there. So it is an investigational vaccine not listed for any indication. Directly from the FDA website, people. It's an investigational product. And the second part of this is not licensed for any indication. All right, I'm sorry. I'm going to go back to breathing. Always go back to the breath. All right. So now it approved, they reviewed the safety and efficacy And I just want to show you this other thing. They did 37,000 participants, followed for 2 months. 2 months. That's 8 weeks, 60 days. And then they said, looks good. Let's approve it and give it to an entire population. You decide for yourself if you think that's appropriate. Okay. 2 months. Now, I always say this for those of you who have little kids, would you put your child in a car seat that was only tested for 8 weeks? I want you to really think about that because I actually was witness to a car accident a few years back, probably 2 years back. I think right before COVID hit. I can't remember. The truck went around the corner and it hit a telephone pole, then it flipped on its side. And because I saw it, I got out of my car to see who was inside, and there was a mother and a little girl, and she was between 2 and probably 2.5. The truck was on its side and the windows were all shattered out. So I looked inside to see if everyone was okay, and it was a little girl still intact in her car seat. And the car was on its side, and the car seat was still intact. Like it hadn't even moved an inch. And the little girl was tightly buckled in, and all I saw were her legs dangling, and she hadn't been touched, and she was completely fine. That's the kind of car seat you want for your kid, right? Am I right? Yeah. And I was there. I had the police officer take out the car seat. I snapped a video and I took a picture and I posted it on Facebook because I'm thinking all parents should be getting this car seat. We want to feel this safe with our kids. We want to protect our kids, right? That's how we want to feel with this untested, unproven investigational product. But how can you do that after 8 weeks? You can't. You can't. It's impossible. It's just impossible to expect entire population after 8 weeks to take this investigational product and be okay. I want you guys to understand this. This is not right. It's not right. And I have to tell you something. For that car seat, you know why they try so hard and they probably put it through so many tests? Because they're held responsible. If a child were to die and it was due to irregularity within the car seat, those car seat makers get sued and they get sued their pants off. So they're going to try even harder to make that car seat prevent death, right? Yeah. But with this investigational product, they're not held liable. So how careful do you think they're going to be if they're not held liable? They just whipped it up after 8 weeks. That is just wrong. It's not even ethical. It's not even science. And I'm not a scientist, and I can say that. But they're saying they didn't identify specific safety concerns. All right? Because they didn't test it enough. That's why. All right, so let's go on. Now I want you to bring let me just this way down here. So this is the criteria for emergency use. There's got to be there's 3 things. That this SARS-CoV-2 can cause a serious life-threatening disease or condition, including severe respiratory illness to humans affected by the virus. Yes, that's true. But there's a 99.9% chance, or there is a 99.91% survival rate. So think critically. Do we really need an untested, investigational, non-FDA approved pharmaceutical product being injected into an entire population when the entire population has an over 99% chance of surviving this? And does that risk outweigh the benefit? So think critically, really think critically, put those thoughts together and think about it. And don't go on what your friends or family tells you or the news. All right, based on this, it's reasonable to believe that it may be effective. But you know the other word they're not using? It may not be effective. So it's a little play on words there. It may be effective, but it may not be effective. Okay, so they think that it outweighs the known potential benefits when used to prevent, outweighs the risks. So hopefully I said that correctly. All right. And then this is a lie. There's no adequate, approved, and available alternative to the emergency use. That is a complete and utter lie. Do you understand this? That's a lie. It's a lie. It's a lie. It's a lie. There are approved treatments and they have been studied well and they have helped people. But you cannot give this product, this untested product, emergency use authorization if there is something else available. Okay, so now think critically with that. Really put that together. If the FDA approves something else that's $12 and it cures this illness or prevents hospitalization and it prevents you from getting severely ill, it can't put the untested, unproven, non-FDA approved pharmaceutical product out there. They can't give emergency use authorization. So they are saying there's no adequate, approved, and available alternative. That is a lie. Okay, so put these things together. Who is lying to you and who's telling the truth? Put these things together. Think critically and think critically for yourself. Okay, so they concluded that stakeholders. Who are the stakeholders? Emergency use stakeholders refer to a public health agency and its delegates that have legal responsibility authority for responding to an incident. This is interesting. I'm not going to get really into that, but that's interesting. All right, so I'm going to go down here and I want you, this is a really, really important, and this will say it all for everybody. All right, it's 9 pages long. Let's just keep going down here, down, 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 conditions of authorization. A really good statement coming up, guys. So just give me a minute to get there. May develop. Okay, so this is interesting. I found this. This is not the statement that I'm saying is really important, but this is important too. All right, so Pfizer, the actual people who make the vaccine, may develop instructional educational materials, but they don't have to go without FDA's review. Another thing you need to think critically over. So this is available to you online. You just have to do your research and think critically. Read each line and just think for yourself. Why would they allow the drug maker to put out an educational material to the public without it having to be reviewed from the FDA? Because now they can put anything out there. They can put anything on the educational material and the FDA doesn't have to review it. But, you know, as long as they're consistent with the authorized labeling. All right. Okay. All right. So let's go down. So now they're saying they have to will report to the vaccine adverse events reporting system, but do they really? Do they really report these events to the adverse events reporting system? That's where all the adverse events reports should be going. And I did another video on that. So obviously there's been severe adverse events, cases of multi-symptom inflammatory syndrome in children and adults, and cases of COVID-19 that results in hospitalization or death that reported to Pfizer. Okay, now listen. Pfizer must submit to investigational new drug application number 19736. So I want you guys to look that up. Just Google it. Just Google Pfizer investigational new drug application number 19736 and see what you can find. So this is all about doing your own research and thinking critically. And don't worry about what anyone else says. You do your own research and put the pieces together, put the puzzles together, okay? All right, so now they want a narrative summary and analysis of adverse events reported interval, including interval and clinical counts by age groups, special populations, pregnant women, and adverse events of special interest. All right, so let's just keep going down here. I'm gonna go down. All right. Okay, so here it is. I want you to show this to your family and friends. Okay, this is on page 9. So it's the last page of the emergency use authorization. This product has not been approved or licensed by the FDA, but has been authorized for emergency use by the FDA under the EUA to prevent the disease or the illness. So this is the most important sentence right here, and it just says it loud and clear. The product has not been approved or licensed by FDA, but it's been authorized for emergency use by the FDA. Completely different. Okay. So show that to your family and friends, and then there's just in black and white. There's nothing to argue about. And then I want to point out here that everybody who's taken this investigational product is part of their study. So you are being the guinea pigs. And this is going to explain that in black and white. Pfizer will conduct post-authorizational observational studies to evaluate the association between the Pfizer BioNTech V and a pre-specified list of adverse events of special interest, along with deaths. So they're admitting there's deaths and hospitalizations. They're admitting there's hospitalizations and severe C19. The study population should include individuals administered the authorized Pfizer V under the EUA in the general US population, 16 years of age and over, populations of interest such as healthcare workers, pregnant women, immunocompromised individuals, subpopulation with specific comorbidities. The study should be conducted in large-scale databases with an active comparator. Pfizer Inc. will provide protocols and status update reports to the IND 19736 with agreed upon study designs and milestone data. You have to understand that because it's an investigational product and they don't have long-term studies and they're pushing this unapproved investigational product out into the general population, that you are now part of the study and you didn't even give consent to be part of a study, and they're not even giving you fully informed consent. This is part of fully informed consent, going over this with all of the data that they have that they don't have too. Okay, so everybody, please think critically. This is the most important time in history. This is crimes against humanity. This is criminal offenses that we are pushing this untested, unapproved, no long-term studies, investigational product on the entire population. All right, so share this with your friends and just go to fda.gov right up here and just click in Pfizer BioNTech COVID-19 emergency use authorization letter and read it for yourself. Okay, everybody, that's it. Have a good day.